Hello, everyone, and welcome back to the blog. Believe it or not, last week on March the 5th, really marked the full year since the first case of COVID-19 was identified in Alberta. And at times, it just feels remarkable how quickly this time has gone by, while at other times, the magnitude of our pandemic response reminds us of the everyday challenges and the massive effort it's taken to get to today. Alberta has been a leader in the COVID-19 response from day one. Since the start of the pandemic, actually even before the pandemic started, AHS has made exceptional efforts in building capacity in different ways. Efforts that you made possible, from expanding COVID-19 testing, redeploying and training staff, bringing on additional equipment, creating new supply chains and processes to meet the continuously evolving needs of the pandemic, protecting the health of Albertans and each other, and most recently, rolling out vaccine to thousands of Albertans. This is just the tip of the iceberg of what's been accomplished, all thanks to your hard work and dedication. And joining me today to share their thoughts on what's been quite a year are Dr. Laura McDougall, whom you know well as our Senior Medical Officer of Health, and Nancy Guebert, our Emergency Coordination Center Director. And just to say, I have to say a big thanks to Nancy, who I pulled out of retirement. Nancy could be basking at home right now, but she really took on the challenge and has made such a huge difference in being our ECC director. So thanks, Nancy, for that. And I'm going to start with you. As the ECC director, can you tell us what are some of those early days, what they were like, and how things have evolved over time?
I would say that in those early days, we probably didn't know what we didn't know. This virus was new. Lots of things were happening across the country, across the world. And I would say that we really started to build that plane quickly, mobilizing our Emergency Coordination Center, our ZOCs across the zones, building on the excellent work that Alberta Health Services had already done around our emergency disaster management plans. Standing up task forces and branches and the organizational structure to help us build the guidance documents, do the planning, do the implementation, and do the execution of the plan. I think the other thing too that was that has evolved and was, I think, really important for all of us to remember is that this pandemic and this emergency response really was health related. Fully, 100%. The pandemic and this response really has the art to it and the science to it. And the fact that we had to continue to support the rest of the health system, you know, whether it was a child having a temperature calling, and the mom was calling HealthLink to somebody having to visit the emergency department, babies being born, traumas occurring. On top of the COVID response and the pandemic, we also needed to keep our eye on the rest of the health system right across the province. So that bridge between executive leadership team and the rest of the organization was so important because this was a health response. This wasn't like a fire where you could see a beginning and an end. It continues. It's gone a long, long time. And so our documentation, our planning, our working with task forces to have the building blocks to support staff and physicians and everyone across the healthcare system and the public was so, so important. So I would say that's what's evolved from the beginning to now.
Laura, coming to you, what do you think are some of the biggest challenges AHS has faced during this pandemic?
Well, there's no doubt that we faced a host of challenges together during this pandemic, but it's also true that many of these challenges have a silver lining and lessons to teach us that we can take forward long after the pandemic's in our rearview mirror. An example of some of the challenges would be protecting and supporting our frontline healthcare providers and all the rest of our teams. And this has really been through the amazing efforts of ensuring everybody has access to PPE, the knowledge and the supplies to use it well and keep themselves safe. But it's so much broader than that. It's also making sure that all of our staff and everyone had the flexibility on how to be able to get their work done and really still try to achieve that right balance between getting through the trying times, supporting each other, and still really stepping up to the challenges. And in that whole vein too, the challenge around information, the fact that many people were working from home, the fact that people are working with masks, the challenges of physical distancing, and yet being able to keep those lines of communication open. I really take my hat off to all of the managers and all of the teams who found innovative ways to keep communication going. And of course, to our amazing comms team who helped with the messages and been able to really have the resources there for people to get the information they needed. Other challenges were around evidence, being able to have the information we needed to make good, quick decisions without necessarily having the perfect answers to every question. Our scientific advisory group has really been amazing. If any question that we would throw at them, they'd be able to get us the latest information and really be able to use that in our decision making. Similarly, with the lab, the evidence that the lab's been able to produce, as we all know, the lab's just been incredible at coming up with innovative ways to develop the original tests. I don't know if people remember, but back in some of the weeks in late January, early February, there was more testing being done in Alberta than there was in the entire United States of America. So again, those were the kinds of challenges, getting the systems up and running, and then of course, scaling it up. Scaling up, that's been another one of our big challenges. The lab staff, of course, is incredible and always has been, but to be able to put through the volumes of tests that we needed and continue to need not only the routine tests, but now moving into the rapid tests and the tests looking for variants of concern and the sequencing that give us information about new variants. That whole ability to be able to ramp up has been, again, a massive challenge, both in terms of supply chain, in terms of just staff who are tired and continuing to be able to really sort of push through and be that contributing factor in helping with managing the pandemic. Contact tracing, that whole team, we started with 50 people who knew how to do contact tracing in this province, and we're up to 2,400 people part of the contact tracing and case investigation effort. I think was spoken about in the blog last week as well. Ramping up people to do assessment centers, security, the health staff screeners, environmental services. All of these teams have just come together, some of them new and some of them just ramping up. That's been a huge challenge. Supporting the public, that's been another big area, not only providing incredible care under very trying circumstances, where people are worried about their own health and safety and that of their families, being able to manage through all the challenges of distancing and PPE, and at the end of the day, just continuing to deliver incredible services. Getting that balance in terms of visitation and support from designated family and support people in our facilities it has been another big challenge, because we know having those family members at the side of the patients is so important, but being able to balance that with the risks of introduction of COVID into our facilities. So that challenge has been incredible. Public communication, again, being able to get the right messages out to more than 4 million people on a regular basis through the website, social media, all of the community engagement, the town halls, the interviews that many of our staff have been involved with. That's been an incredible challenge, and again, some really great ways to overcome that. And of course, our environmental public health team, the inspections, the numbers of complaints that they've dealt with. Again, a ramping up story and a way of working with the public that we haven't really had at that sort of scope ever before. And then finally, I'd say the challenge of being able to provide support to the groups who are most vulnerable to severe outcomes. I know this is a part of our mission and the way we work every day, but the outreach, the thinking ahead about the groups who are most likely to fare poorly if they're subject to infections, the teams who've really worked with that wraparound prevention and outbreak management with long-term care and DSL facilities, ensuring they had a 1-800 number to call at the first sign of anyone having any symptoms of infection, and the support, the wraparound support from all the teams to help them minimize the impacts of infections and outbreaks in their facilities. Similarly, with our corrections facilities, that team's just done an incredible job of managing the huge challenge of keeping our corrections facilities safe. And the same with shelter populations, including setting up the isolation facilities when people don't have any other place to quarantine or isolate safely. And really working together with new partnerships to support these groups that are really the most vulnerable. Those have been big challenges. And again, I think we've learned a lot that we're going to be able to take forward with us after this is over.
Nancy, coming to you, what would you say have been some of the most prominent milestones during the pandemic?
Well, Laura has kind of referenced some of them, and you certainly don't want to single, and miss any key milestones. But I think one of the first ones for me was really the stability of our Emergency Coordination Center and our ZOCs. We've had real stability from that since, the first day they were stood up. And I think that really is a testament to not only the zones, but also to the overall organization to have that stability and continuity of our leadership, both at the ECC and the branches and task force and so on and so forth. I think the other milestone is, my gosh, probably over 2,000 documents we've authored, posted, reviewed. And again, it takes a team. And as Laura said, the scientific advisory, the evidence-based, the input we got from patients and families. I would say that the documentation, and then incredible support from our communications and our IT folks, because to make it look right and sound right and meaningful and explainable to those that looked at those documents, I would say was key. I think one of the other key milestones was our capacity plan and our implementation in acute care and the early warning system. And the fact that we could, there was a lot of planning done to ensure we had acute care beds, we had ICU beds, we grew that capacity, and certainly the zone operations really worked so hard to ensure we had that acute care capacity. I think the other milestone is our dashboards. The fact that we can see living everyday moment data of what's happening in Alberta Health Services and across the province. We know where the cases are, we knew where the outbreaks were, we knew how many beds were being occupied, we knew how many tests were being, how many swabs were happening. And again, I could go on, but I think the sophistication of the dashboards and the work that the data and the surveillance teams did is phenomenal. Laura did mention this too, but I mean, to be able to stand up assessment centers and lab that we could swab and process up to 22,000 swabs per day. I mean, phenomenal work. And again, team effort, innovative staffing models to do that. Laura also mentioned our contact tracing team. The fact that now we can, we can case investigate and contact trace over 2,000 cases per day, and we're heading for being prepared for 3,000 cases per day, knowing that the variants take a longer time to do the investigation, but also introducing innovative models. It's not just, we stretch the boundaries that you have pharmacists and social workers, regulated health professionals, as well as non-regulated folks working in pods and teams to find the story about the virus, where they were, what happened, to try to contain it and also learn from it. But on top of that team, we also have them looking at outbreaks in the schools and continuing care, and as well, all the work that they did to support ongoing surveillance. Again, our human resources. I mean, we had staff that were willing to come out of retirement, willing to stretch their boundaries, willing to learn new skills, willing to get refreshed and trained in ICU, I think, you know, just even our work health and safety, our OH&S folks, I mean, you know, the IP&C, I don't want to single anybody out, but honestly, even we have people step up from administration and the nutritional services. How can I help? How can I support you? Can I make phone calls? You know, everybody stepped up to the plate. And I would say that, you know what, people came. We didn't have to pull them. They wanted to come and help. I think too, now we're into the vaccine. We have a vaccine, huge amount, a few vaccines to choose from, but the fact that we can deliver between 10 and 20,000 vaccines per day, I mean, phenomenal. The online booking tool that did about 60,000 bookings per day, the IT and the web comms trying to get, you know, look at technology, the texting of results, again, just unbelievable work. And then our logistics people, you know, procuring how many beds, how many IV poles, how many IV pumps, and to ship them all across the province where they were needed so we could support the care in the acute care. And then the guidance documents, you know, guidance documents to tell us about IP&C, our vulnerable populations, the whole package to support our shelters and our vulnerable populations, the visitation guidelines. I mean, I could go on and on, but I would say that those are just a few of the highlights of the milestones I saw. And this experience will go down in history, and AHS can be very proud.
So Laura, I'm going to come to you next. Looking back, and I know it's going to be really hard to pinpoint anything, because for me, I'm just really proud of the whole organization, but are there any particular things that you are most proud of about our response to the pandemic so far?
What I'm most proud of is the way we have come together. I know, Verna, you just said that it really does speak to the years of building this incredible organization to be able to do that. But easily, it's what I think we all should be the most proud about. The way that whatever the problem was at hand, whatever that challenge was, teams came together. Teams from zones, team from provincial programs, from SCNs, from every different department that you could imagine. Nobody asking, you know, who's in charge of this or who's going to get credit for that, but how do we solve this problem together? How do we do it efficiently, and how do we be innovative in going about doing it? So to me, that's what I'm most proud of is this whole group and how we've really pulled together. I think the other one is, you mentioned it too, is how we've learned, how we've actually gone out of our way and purposefully taken lessons from one example and setting and applied it somewhere else. I think Nancy's example, this happens every single day, where the experiences are shared from ZOCs and teams back to ECC. All of the other zones get to hear and listen to what's working, to what the challenges are, and how things are being resolved. And that cycle of, you know, the provincial programs and stepping into action to provide support, finding out whether it's working, and then learning from that and going forward up and down the zones and across the organization has been incredible. Similarly, when certain events have happened, when we can predict that they could happen somewhere else, teams stepping in to help prevent that from happening somewhere else, or if it does, sharing the learnings in such a generous way. I'm thinking of the very large outbreak in Cargill and Calgary zone, the very innovative and multi-sectoral response that the team pulled together, working with primary care, community partners, all kinds of organizations to be able to provide the support to the workers through that outbreak. And then as other outbreaks occurred in other meat processing plants, the teams instantly having the lessons and being able to respond in a different, very quick way, building on what we'd already learned. So to me, those are the two biggest points of pride.
Thanks very much, Laura. I think, you know, for me, AHS has never been known to be a nimble organization, right? But man, I think we are so nimble during this pandemic. And you know what you've shared just sort of pulls out some key words for me when I think about how we've come together as a team. First one is really around generosity of spirit and effort. I think that, you know, people have been so generous with their time and their commitment and compassion. The The second thing that you need when you actually work well in a team is trust. You need to trust each other. And I'm so proud of the fact that we've been able to build that. Third one is excellence. I think we've been achieving excellence and also being very accountable and responsible for what we're doing. So many things that describe us. Those are just some words that come to mind. So I'm going to come to one last question for you both. And it's not an easy question, I would say. But what would you say is your number one takeaway from this past year? And so Nancy, I'm going to start with you.
Okay, so I think for me, it is the tenacity, the resiliency, the can-do, and we're not going to be beaten down attitude and approach that I saw and felt and experienced throughout this last several months. And I think it's just, again, as you just mentioned, it's the testament of the strength of Alberta Health Services. There's a reason why we are so effective as one health system. And again, there's lots of people that are tenacious and will not be defeated. And we are going to get through this. And I would say that's the one thing that I will remember.
For me, my one big takeaway from this is, again, working together as an organization, being able to tackle problems all the way from preventing them, supporting community action, and being able to actually tackle the upstream aspects of a condition, all the way through in a coordinated way to being able to take care of patients as we need to along the pathway. And again, as I'm thinking about the other really important health concerns in Alberta, almost looking forward to tackling those in a new way going forward, be it opioid overdoses or injury prevention. I think all of us working together, we found a new way to tackle those really big problems.
Perfect. Thanks very much to the both of you. And I'm not sure I could have actually come up with one particular thing, but I would say that for me, the big takeaway is actually the resiliency, not just on a personal front, I think for every one of us, but also the organizational resiliency to be able to deal with the pandemic. So really want to say thank you again for all that you do, not just for coming on today on this blog, but for your incredible commitment and leadership over this past year. I'm sure that neither one of you knew that this would be taking a life of its own over the past while. And Laura, I know when you took on the job of SMOH, I don't think you thought you'd be leading a pandemic, but we are so lucky to have the both of you. So thank you so much. I just want to close this week's blog by just saying how everyone at AHS has responded to this challenge with a level of commitment and teamwork that continues to be truly inspiring. Every single day you work tirelessly, fiercely, and with compassion, and that has really made the difference. It makes a difference to Albertans every single day. And you can see that our day-to-day interactions, all the messages of thanks left by Albertans on our Share the Love page, as well as our milestones and accomplishments highlighted on ahs.ca/COVID 1 year. I'd like to read one of these messages now for you. So in quotations, thank you all so much for fighting to keep us all safe and healthy, for sacrificing all that you do, that cause, for helping so many families stay strong, for doing the superhuman work that so many others can't, for everything that may go unappreciated. To all of our frontline workers in every area and in every capacity, a resounding thank you, quotations. I couldn't agree more. And from the bottom of my heart, thank you to all of you, all of our staff, physicians, and volunteers. I'm so proud to be part of such a dedicated and compassionate team. I know the challenges of the past year has had an impact on the mental, emotional, and physical health of so many. If you need support, please reach out to our Employee and Family Assistance Program. This service is totally confidential and is available 24/7 at 1-877-273-3134. You can also find more information on Insight. So thank you again for all that you do, and we'll see you next time. Stay safe and stay warm.
Together, we do amazing things every day.